It seems like it's been 40 weeks since you got 40 winks. Your back pain? Unbearable. Tossing, turning, trying to find that pain-free position. And that's the moment you realize you can't spend another waking moment putting off treatment.
The Joint and Spine Center is Cincinnati's leading destination for spine care, with a ton of surgical and non-surgical treatments for back pain. So when a moment has the power to change the rest of your life, go to the one place with the power to change it for the better, the Christ Hospital Health Network. This changes everything.
The Pound This Podcast is brought to you by the Christ Hospital Health Network. This is the Pound This Podcast, episode 712, How a Primary Care Physician Can Help with Physical and Mental Health, with Dr. Elizabeth Peters.
I want to lose weight, but I don't know how to get started.
What should I meal prep every week?
How do I get those sweet booty gains?
Inspiration for your healthy lifestyle. The Pound This Podcast with Amanda Valentine.
Thank you so much for listening to the Pound This Podcast. I am Amanda Valentine. I am joined by Dr. Elizabeth Peters from the Christ Hospital. How are you?
I'm doing so well, Amanda. Thank you so much for having me. It's great to be here.
Yeah, it's so great chatting with you. We were just chatting before we started recording about some of your background being a group fitness instructor, which I want to get into. But tell me about your background and your role at the Christ Hospital.
Yeah, so, group fitness instructor, one of my favorite jobs in the past, but specifically at Christ Hospital, I am a primary care doctor. I'm a family medicine trained primary care physician. So that means my background is in family medicine. So I was trained in my residency to see patients from newborn through geriatric, so kind of across the age spectrum, for a variety of primary care needs, which I'm sure we'll talk about more throughout our time today. And then kind of hopping back before residency, I went to medical school at University of Cincinnati and grew up here in Cincinnati. So I'm a Cincinnati gal, born and bred, and I'm really excited to be, joining a practice here in Cincinnati and serving the community that gave me so much.
So what made you decide that you wanted to just go into the job that you have now and kind of be, just a general practitioner?
Yeah. I think, over time, kind of growing up, having wonderful primary care doctors that I met in my own life was a huge inspiration. Kind of going through medical school and residency, I liked everything. I liked a little bit of every kind of specialty we rotated through, but ultimately I loved the idea of growing relationships with people over time and getting to know not only my patients, but their families. I thought that was a really, really cool aspect of care that really made an impact on people, was getting to take care of not only them, but their families. And I just liked the idea of not losing a patient over their lifespan, but getting to continue to care for them and meet them where they were. So those were some of the aspects. I think another thing that I loved was getting to talk a lot about preventing disease and kind of doing a lot of things to take care of patients rather than always retroactively dealing with issues that came up. So preventive care was a huge interest of mine.
Well, and that just seems to be one of the biggest benefits of having a primary care physician. And I know for myself, for a long period of time, like through all my 20s, I don't need to go see a doctor, like whatever. I don't need like a primary care physician of like, when something's wrong, then we'll figure it out. But it feels like it should be expressed that it's important to have that doctor. I mean, especially for me, which I do want to get into of my chart, because I know I ask questions all the time, but to have somebody that is kind of like following along on your journey for you. So it's not, oh my gosh, something's wrong and it becomes an emergency situation and then you're thrown into a doctor you don't know. That, again, I would imagine that's one of the biggest selling points of it, wanting to have, this is your doctor, so you can have somebody that you have a relationship with, that you feel comfortable with, so you can discuss these health issues.
Exactly. I mean, we've all been there, Amanda. We've all been, not connected with a primary care physician, so no guilt there. But I think obviously I'm biased in this, but having somebody in your corner that you trust and who's there, when something comes up, when you do need them, but also who you can just throw a MyChart message to, that you can just call and ask a question. And then, of course, who can be there to take care of your preventive health needs, to make sure you're being screened for all kinds of different age-based screening things that you should be looking out for across your life. So I think having that person in your corner, a primary care doctor or primary care provider, whoever that might be, is super important. And yeah, I love getting to be that person for folks.
So what kind of things do you kind of take care of on a daily basis? Because I know for me in the past year, in 2020, I didn't realize I could go to my primary care for mental health concerns. And when I went in to actually get some blood work done for something else, we discussed that. And I'm like, oh, I didn't realize that you could prescribe antidepressants, that we could discuss my mental health. I thought that was, I had to go to a psychiatrist or somebody else for that. And I was like, no, this is a discussion that I can have with my primary care. So that was new information to me. So what kind of other things do you handle on a daily basis that people might not know about?
Exactly. Yeah. So I think this is something that comes up a lot in my office too. And just with my friends when we're talking about primary care, right? The primary care doctor's purview or provider's purview is much broader than a lot of us think. So and it varies a little bit based on kind of the background of your specific primary care provider or their scope of practice. I'll just speak kind of from my practice and for most of the family medicine providers in the area. We manage a lot of mental health. So pretty much any aspect of mental health that is kind of a basic issue, depression, anxiety, a lot of different mental health issues. And let me tell you, a lot has come up in the past year with the pandemic, right? We're in unprecedented times dealing with, so many issues that a lot of us never anticipated dealing with. So we can address a lot of mental health issues. We often have behavioral health providers in our office with us, like counselors, social workers who are specifically trained in addressing mental health issues that work alongside us, providing some counseling or therapy services or can help get patients plugged in with those services. Also, as primary care providers, we are trained and very comfortable providing medication for mental health issues across a variety of diagnoses. So that is totally something that's within the primary care spectrum of care in my practice and in all of my colleagues in the Cincinnati area. So yeah, definitely feel comfortable to bring that up with your provider. And I'm so glad you were able to have those conversations with your provider. I think another area that I get questions about a lot from folks is kind of reproductive health, women's health issues. A lot of folks have a gynecologist specific to address those issues. I think one thing to remember is from a primary care perspective, a lot of primary care providers, myself included, are trained to do pap smears, to do pelvic exams, to take care of that aspect of care. And so it can be one of those areas where, if you're interested in making, one visit, your primary care provider would be happy to take care of that part of your care as well.
Oh, that's cool.
I think those are two areas that often come up, in addition to kind of all of the other aspects of care that a primary care provider can help with, like your annual screenings, getting that routine blood work, making sure you're caught up on vaccination, and really just addressing any questions you might have about your care in general.
Well, I know so many women specifically in my life that have expressed some fear of going to the doctor just because they have the fear of being told you need to lose weight, or you're overweight, or you're having these issues or high blood pressure. They're just afraid to hear that news. And specifically, when they're talking to me about this, because this is a topic of conversation I get into often when, kind of around weight and body. And So I think they either avoid it or kind of go in with like gritted teeth. But is it that's something that they can come to you and it's not, like, can you get that like good advice on that rather than just like, hey, your BMI is here, go lose some weight. Like I imagine that you have, especially since you have a fitness background, that there's, you specifically, but I'm thinking doctors in general. I don't think I'm sure there's instances where people have this harsh, kind of conversation and goes to a scary place. But to me, I think that's probably just an overall general fear more than it actually happens in real life, where you can have these kind of more comfortable conversations about, weight and health and some realistic options to solve those problems rather than it being this like scary doomsday conversation that you try to avoid.
Oh my gosh, yes. I mean, you've hit the nail on the head with a lot of folks have a lot of reasons to have fear about going to the doctor, right? So I think that's one of the opportunities as primary care providers that we have is to build trust with our patients and to build that relationship so that hopefully, by the time we're getting to a lot of these conversations, there's a level of trust and comfort so that these conversations aren't as scary and fear-centered. However, certain topics in our lives are always going to be touchy or, there's always going to be an aspect of fear. So I think your point about how can we have these conversations and not have that fear, I think a lot of times it really does come down to having a provider you trust, that you have a relationship with. I hope as providers we're sensitive when we're talking about those topics, right? There's a way to go about those conversations that doesn't cause additional trauma or fear for our patients, because there's a lot of hard things we talk about as primary care doctors. So I think meeting folks where they are on any of those issues, whether it's high blood pressure or weight, and figuring out kind of what small steps can we take a little bit at a time. I think one of the benefits and things I love about being a primary care provider is you get to see people pretty often. So we can take things one step at a time and find a plan that patients are comfortable with for the short term and just chip away at it. So I think really the way I approach those discussions is really asking for permission from my patients about what they're open to talking about, what they feel comfortable talking about. And we work together on our priorities and what we're going to tackle for that visit. And then just take it one piece at a time. I think you really have to, I have to meet my patients where they are, and I don't want to do anything that makes them feel uncomfortable, right?
Yeah.
And so really it's a matter of providing education on why it's important to address blood pressure, why it's important to talk about our overall general health, but then making a plan that works for everybody to tackle it.
So this is random, but I know that like, especially with COVID the past couple years and, a lot of people doing home workouts and stuff like that, there's always a disclaimer on everything of like, consult a physician and get clearance before you do any sort of physical exercise. Does anybody ever do that?
You'd be surprised.
Really?
I think, for the general young, healthy person, yeah, I think nobody's really doing that. But a lot of times good questions do come up. I have a family history of heart disease. Can I still do this level of exercise?
Okay.
Any question you have it's a good question. It's valid. If you have it, that's what we're here for. So I would say 9 times out of 10, when folks are asking me those questions, yes, I will happily clear you for exercise, but it often brings up a good conversation about, hey, what's your usual workout? What kinds of things are you doing to stay active? So yeah, there's no bad questions. They all lead to good conversations. So I'm happy to field them anytime.
So with your background and fitness, which you were telling me you've been a fitness instructor at Miami and UC, correct?
Correct. Yeah, I started my group fitness instructor journey as an undergraduate at Miami. That was awesome. It was one of my favorite jobs. I taught spinning and a couple of other classes at the rec center up at Miami, and then continued that during medical school at UC at the rec center at UC. Yeah, such a great job, such a happy job. And again, kind of one of the things I loved about group fitness was, it always puts you in that good mindset. You're surrounded by positivity. It's just a feel-good thing, right? And getting to focus on getting that hour or so to focus on your health and listen to some good music along the way was always awesome. Yeah, I love that aspect of group fitness, and I still do.
So how do you think that from working in that and also participating, has that informed your job now, or has that are you bringing parts of that into how you're a doctor?
Yeah, I've never really thought about that, but I think just prioritizing with patients, making is something that, from the coaching aspect of group fitness, it does kind of carry over. It's something that we're always making an agenda or a plan, or kind of trying to tackle problem by problem. I think in a group fitness setting, folks are working on kind of often different goals, but sometimes those goals do overlap between the gym and in the office, their general health. So I think that coaching aspect of supporting people, encouraging people, is something that I love about group fitness, and I love about being a primary care doctor.
That's awesome.
So in that way they overlap, although, man, I miss making those playlists.
Yeah. Well, Spotify makes some good ones too. You can find everybody's on there.
It's true. Yeah, you can.
So I did want to talk about MyChart, because that is probably the main tool that I use with my primary care physician. And I just used last week with my gynecologist, because I love I have a question, something's going on, well, let me just hop on MyChart and ask my doctor. And I get an answer always within a couple hours. And that's where a conversation just came up a week ago that somebody was talking to me that she was having issues with her menstrual cycle, had heard other people were having the same issues, and said, hey, someone told me in my family that was due to the vaccine. It's one of these side effects people aren't talking about. It's interfering with my menstrual cycle. And I'm like, she's like, have you heard of that? Is that true? And I'm like, I haven't heard of it. Just let me go ask my doctor. This is why I have, just
Absolutely.
Doctors on call of let me hop on MyChart and ask my gynecologist if is this something that you've heard of? And she said no, but she's just the studies are still being done. And, I personally haven't had that come into my office. So I can't say that that's a thing or it's not, but it's hey, I went and immediately got an answer from a doctor to kind of see what's going on in her scope of practice versus the internet, which can be an awesome but awful place at the same time. And I just thought that it's just so useful. Or even for me of hey, I'm feeling this sort of way. Is this something I need to come to the office about? Is this something I need to worry about? And I just got a concussion in May, and there was a lot of MyChart back and forth between me and my primary care of versus at what time am I all right? This is what my symptoms are. Am I getting better? Am I getting worse? And it was just all answered immediately and without me just sitting here stewing in my own worry. And that is priceless in my opinion.
Totally. I mean, I think MyChart is such an awesome tool, and I applaud you and all my patients who go to MyChart when they have a question to ask a provider, because, we do a lot of training, we do a lot of school, and there's a lot of information coming at us all from all directions, especially in the past year, about whether it be the pandemic or other health issues. And so I think seeking out a medical provider when you have a question about your health is a great route to take. And I love that MyChart makes it a little more accessible. So I definitely recommend that. And yeah, I think, even though we have a lot of training, we don't always know the answer, but MyChart allows that accessibility. And if we don't know, we find out through kind of really reliable sources and all of that. So I think being able to take that worry out of our patients' hands and put our heads together on things is a really cool part of the technology that MyChart is. And that's awesome that your provider got back to you so quickly. I think, on the other side, sometimes it takes us a couple days to get back to MyChart messages, and we're often triaging, deciding kind of what needs to be seen first. So we always say, never use the MyChart for something urgent, but questions like that, you're okay to get an answer back a couple of days later. That's what it's perfect for. So, and oftentimes, a MyChart message leads to a little more discussion, and I'll say, hey, it does seem like we could talk a lot more about this. Let's get you into the office so we can have a quick visit. But sometimes it's just as quick as you said, like it was with your provider. Hey, no, there's no evidence to suggest that the vaccine interferes with menstrual cycles. But the data is always changing and growing, and we're learning every day.
I imagine this has to be an interesting time to be a doctor with all of these COVID questions that you just can't possibly have the answer to if no one has the answer to them.
Yeah, I think, as a scientist, I think it's been a really interesting time. We have new data all the time, and so we're getting better answers over time as new evidence develops and we know more. I think it's amazing how fast the vaccine was developed and how over a year and a half, 2 years, we've learned so much. At the same time, sometimes that can seem frustrating to folks. It seems like the answer is changing all the time.
Yeah.
I try to frame it, from that science background. I think it's great that we're learning more all the time. And yeah, it can be hard to keep up, but that's why it's so awesome to have colleagues who are, we're all diving deep into the pandemic data all the time, and we have really strong resources and reliable resources that we're using. So I think, again, one of those reasons why it's always good if you have a question to reach out to a trusted provider who can give you the best answer based on all the information we have at the time.
And do you utilize telehealth pretty often now?
Yeah, so telehealth has been, that's another area with the pandemic that I think has really blossomed faster than many of us ever imagined it could. So I think that's one of those things that is really convenient for patients, and when it's the appropriate time and place and reason to use telehealth, I love using it. I think it saves patients time and provides a more convenient way to provide care when it's appropriate. So I do telehealth visits. I love kind of meeting patients in that way, especially once we already know each other and are established. And if that's a way we can kind of get some things accomplished in a more convenient way, I'm all about it.
So are you accepting new patients if somebody's listening to this and they're in Cincinnati and they're like, man, I need a primary care. Dr. Peters sounds awesome. I mean, can they come search you out and, link up with you and have a conversation with you?
Absolutely. Yes, I am accepting new patients. I'm up at Montgomery, just past 275, and I would love to see ya.
That's awesome. And I'll put some links and stuff in the show notes. And it was so awesome getting to know you. And if you're ever up for a workout,
oh man, that's awesome. I would love that.
Yeah.
I always love trying something new. That's one of the best parts about group fitness, right? Is there's always some new trend, some new thing to try, but I love switching it up and keeping it interesting.
Definitely. Yeah. So if you ever want to come do, I've never done a workout with a doctor before. That'd be fun. Be like, my heart's in good shape, I promise. Which I actually tried an Orange Theory class for the first time a few days ago, and they were kind of explaining to me all the things in there, and they're like, oh, you have like a perfect pyramid. You could tell that, your heart's in good shape and that you work out. And I'm like, wow, my heart's in good shape. Cool. I don't know why I nerded
Awesome.
out about that. I was telling my husband that. I'm like, look, that's me. Like, I'm in control of my own health here. Like, I've put my heart in a good position where I wasn't just dying doing this class. I'm like, I don't know. That stuff's exciting to me of like, man, you can just really work on yourself and you know, can kind of take control of things like your heart health, because I've been a very unhealthy person in a lot of my life. So to be able to be like, I turn that around. And then when you see kind of, you know, the data behind that, and you can kind of see your heart rate and you can kind of see how everything's working. I like all my step counts, and I kind of like the graphs and charts for the fitness stuff. So I don't know. I think that stuff is exciting for me, and it sounds like that's probably exciting to some degree for you as a doctor, of seeing like, you know, physically,
totally.
like this is showing me exactly what's happening.
Yeah, getting that, you know, that objective feedback and being able to use technology to kind of see what our bodies are doing. I think everybody loves that, and it lets us take more control of our health, which is always good. So yeah, it was so great being here, Amanda, and thanks for inviting me and giving me the chance to talk with you.
AmandaValentineBites.com